Hello everyone, I am Dr. Shankar Dey. Welcome to second session of INICET Recall Question Session May 2022. So starting with question number 11, MAC class 1 activate which cell? So MAC class 1 activate among this option, the right answer is cytotoxic T cell, also known as CD8 plus cell. So MAC class 1 activate CD8 plus cell, and this helper T cell or CD4 plus cell is activated by MAC class 2. MAC class 2. The question asked about MAC class 1. So the answer is cytotoxic T cell or CD8 plus T cell. So let's learn something about MAC. So what is MAC? MAC is major histocompatibility complex, also known as HLA, human leukocyte antigen. So MAC or HLA, human leukocyte antigen. This MAC gene is located on chromosome 6 short arm. So short arm of chromosome 6. What is the difference between MAC1 and MAC2? First of all, location. Location wise, MAC1 or HLA1 is located on all the nucleated cell and platelets. So all the nucleated cell and platelets, and MAC2 or HLA2 located on only on antigen presenting cell like dendritic cell, fibroblast and endothelial cells. Further type of HLA like HLA A, B, C or HLA2 like DP, DQ and DR. And what about attachment? MAC class 1 presents antigen to CD8 plus or cytotoxic T cell. So this is cytotoxic. The question asked was this. So MAC1 attaches to cytotoxic T cell and MAC2 attaches to helper or CD4 plus lymphocyte. Antigen binds to MAC1 at the junction cleft between alpha 1 and alpha 2, and in case of MAC2, antigen binds in the cleft between alpha 1 and beta 1. Major role of MAC1 is graft rejection in graft rejection, and in case of MAC2, graft versus host disease. So this is about MAC, major histocompatibility complex or human leukocyte antigen. Next, coming to question number 12, which triad is seen in angle closure glaucoma? Among this option, the right answer is Vox triad. So this is seen in angle closure glaucoma. So let's learn about this option. First of all, Vox triad. What is Vox triad? This triad is seen in post congestive glaucoma, and this triad consists of number 1, glaucoma flecken or anterior subcapsular lenticular opacity, number 2, patches of iris atrophy, number 3, slightly dilated non-reactive pupil due to sphincter atrophy. What is Hachimsan triad? It is triad seen in congenital syphilis, consists of number 1, Hutchinson's teeth. See the peg-shaped incisor teeth. This is Hutchinson teeth. And second one is interstitial deafness, and third one is interstitial keratitis, and third one is sensory neural deafness. So this is Hutchinson triad of congenital syphilis. And what is Virchow's triad? Virchow's triad is triad for thrombosis, consists of first of all endothelial cell or vessel wall injury, number 2, stasis of blood, number 3 is hypercoagulability. So this is Virchow's triad for thrombosis. So Vox triad is seen in angle closure glaucoma. Next, question number 13. A 36-year-old female having regular intercourse, nulliparous on OCP, having family history of cancer, mother at 50 years of age and sister at 40 years of age. What is the next best advice for this 36 years old female? The best advice will be genetic counseling for BRCA testing. So as the lady has family history of cancer both in mother and sister, here both the sex is female, so female predominant cancer, family history, So these patients are more prone to develop breast cancer because history of breast cancer may be there. So this family, this 36-year-old nulliparous female should be counseled about BRCA testing. So let's learn about something about BRCA, very important topic for upcoming exam. So BRCA1 and BRCA2. Before going to BRCA1 and 2, two important points about some mutation. Most common gene mutation is breast carcinoma is P53. So remember this, most common gene mutation for breast cancer is P53, but most common gene mutation in familial breast carcinoma is BRCA1. So if familial word is mentioned like familial breast cancer, then it is BRCA1, but only breast cancer is mentioned, then most common gene mutation in breast cancer P53, most common gene mutation in familial breast cancer BRCA1. So there is two type of gene, either BRCA1 or BRCA2. So BRCA1 is located in long arm of chromosome number 17q, and BRCA2 is long arm of chromosome number 13q. So BRCA1 is related mainly with breast carcinoma, but BRCA2 is mainly associated with male breast carcinoma. So male breast carcinoma more predominantly seen with BRCA2 and female more commonly with BRCA1, and rest of the carcinoma like ovarian, pancreatic, prostate is also more commonly associated, though two types of gene is associated with all type of these carcinomas, but more commonly this carcinomas is associated with BRCA2, and breast carcinoma in female more commonly associated with BRCA1. So remember this, BRCA1 and BRCA2. Next, coming to question number 14, a 30 years old male having blunt injury to abdomen, but there was no blood at tip of meatus, external urethral meatus. During examination, Foley's catheter was inserted and urine collection was minimum. So there was minimum urine collection following Foley's catheterization, and patient had history of blunt injury to abdomen, but on examination no blood at the tip of meatus found. So how will you manage? So after seeing this image, the probable diagnosis is intraperitoneal rupture of bladder. Intraperitoneal rupture of bladder. As all of you know, in case of urethral rupture or extraperitoneal rupture of blood, there will be blood at tip of meatus, but in this case there was no blood at tip of meatus, and there is also minimum urine collection because of intraperitoneal rupture. Urine is extravasating to the peritoneal cavity. This is a very emergency case, and how will you manage? The first thing that you will do is laparotomy, emergency laparotomy to repair the bladder wall in 2 layers. So this was about intraperitoneal rupture of bladder. Next, coming to question number 15, which of the following condition is not caused by high risk human papilloma virus? So HPV. So cervical carcinoma is caused by high risk virus, also anal carcinoma, also oral carcinoma. But laryngeal papillomatosis or juvenile laryngeal papilloma, this is caused by low risk type of HPV, like HPV 6 and 1. So answer is laryngeal papillomatosis. So let's learn something about laryngeal papillomatosis. Laryngeal papillomatosis is most common benign tumor of larynx in children. This is usually caused by low risk type of HPV, like HPV 6 and 11, transmitted through mother during delivery through vaginal route. Presentation is like hoarseness of voice first, followed by the stridor. Management includes, mainstay of management is microdebrider, then alternative is CO2 laser or KTP laser. And what is the post-op treatment? That is a very vital, ABC. Post-op treatment includes treatment with either alpha interferon or B for bevacizumab, or C for cidofovir. So this is about laryngeal papillomatosis, most common benign tumor of larynx in children. Coming to question number 16, which of the following cost effective test is not done as regular screening test for pregnant women? So which is not done regularly for screening test? So not done, so see carefully, not done as a regular screening. HIV test done for all pregnant individual for regular screening, yes. HPV test, yes. VDRL for syphilis, also yes. But echocardiography is not done as a regular screening for all the pregnant women. So this is the answer. Echocardiography is not the cost effective test to done regularly for every pregnant woman. Next, coming to question number 17, function of superior oblique muscle. Function of superior oblique muscle, as all of you know, function of superior oblique muscle is intorsion, then depression and abduction. So this is the function of superior oblique muscle. Among the options, the right option is intorsion, depression and abduction. This is the right answer. So this is very important question. Extraocular muscles function, you should know the primary, secondary and tertiary function. The question was about superior oblique. See, primary action intorsion, then secondary action depression and tertiary action abduction. So you should memorize this list because this is very important. You may expect 1 or 2 question in the upcoming exam from this table only. And also the nerve supply is also important. As all of you know, the mnemonic is all 3 SO4 LR6, means this superior oblique muscle is supplied by 4th nerve, are also known as this superior oblique is supplied by 4th nerve, or also called as trochlear nerve, and this LR6 means lateral rectus is supplied by 6th nerve or abducens nerve. Rest of this medial rectus, inferior rectus, superior rectus, inferior, these nerves are supplied by all 3 or 3rd nerve. So oculomotor nerve. So this is the nerve supply and action. This table is very important. Action, nerve supply, origin, insertion of extraocular muscle. So read it carefully. So what is the ratio of T and B lymphocyte in the peripheral blood? So among these all option, the nearest option that is correct is 3:1. So T lymphocyte and B lymphocyte in peripheral blood ratio is 3:1. See, 60% of the circulating lymphocyte in the blood is T lymphocyte and 20 to 30% is B lymphocyte. So the ratio is near about 3:1. That was the question, ratio of B and T lymphocyte. And T lymphocyte, the marker CD3 marker is the T lymphocyte pan T cell marker. So this is pan T cell marker, and other marker of T cell includes CD1, 2, 3, 4, 5, 7, 8. So 1, 2, 3, 4, 5, 7, 8. And pan B cell marker is this CD19. So this is pan B cell marker, and the B cell marker include CD10, 20, 19, 21, 22, 23, 79A. In case of T lymphocyte, it is formed in the bone marrow, but it is matured in thymus gland. So thymus gland is required for maturation of T lymphocyte, but for B lymphocyte, both maturation and formation occurs in bone marrow. T lymphocyte helps in cell mediated immunity, and B lymphocyte helps in humoral immunity. So this is all about T and B lymphocyte. Question number 19, which is commonly associated with Kallmann syndrome? As all of you know, Kallmann syndrome is a example of hypogonadotropic hypogonadism that is associated with anosmia. So hypogonadotropic hypogonadism with anosmia is typical Kallmann syndrome. So because of hypogonadotropic hypogonadism, either there is absent puberty or delayed puberty, some signs like delayed sexual maturation, delayed Tanner staging or amenorrhea, etc. So this is hypogonadotropic hypogonadism with anosmia. So which is commonly associated with Kallmann syndrome? Answer is anosmia. As I have told you, precocious puberty is not the option, because this is associated with delayed puberty. Next, coming to question number 20, which of the following local anesthetic causes hypertension? Among the four options, as all of you know, this is very easy question. Cocaine causes hypertension, tachycardia, etc. So this question answer is cocaine. So in the next segment I am going to discuss question number 21 to 30. So stay tuned for the next video, and don't forget to subscribe my channel, Dr. Shankar Dey. So subscribe my channel, and thanks for watching. Share the video with your friends, seniors and juniors. Thank you.